Hello there. Welcome back to our sessions on Aarambh Medical Lectures. We will continue with cardiology by discussing the case of a young man who presents to you with chest pain and signs of heart failure. This young gentleman that we will be discussing about today had gone on a trekking vacation. And he's a regular trekker, so generally he doesn't seem to have much of a problem. So he did not really care much about it when he did have a little bit of fever and rhinitis at the beginning of the day. But even before he started the trek, he started feeling a little too tired. And as he started climbing, he developed shortness of breath and palpitation. Surprisingly, he had also developed a crushing retrosternal chest pain. Now, remember, this is a young man who's regularly used to trekking, and he's developed for the first time this crushing type of chest pain after fever and shortness of breath. Of course, his friends decided that, okay, it's not good to just leave it as such. Let's take him to a hospital. And they bring him to your hospital. And as you've seen him at the emergency, you're surprised to see that this young man is febrile, he has tachycardia, and surprisingly, his blood pressure is only 80 by 60. That is, he is a hypotensive. On auscultation, you could hear an S3 sound, which is very classical of heart failure, and you could hear bilateral basal crepitations, suggestive of heart failure again. This young gentleman seems to be presenting to you with heart failure. Since he also has a crushing retrosternal chest pain, the first thing that you would ask for is an ECG. And voila, this is your ECG. Now, if you look carefully at this ECG, you will see certain dreaded signs. Yes, you're looking at ST elevations. Can you have a good look at this ECG and take a call as to what this gentleman has? Just in case you might be thinking that there is a myocardial infarction going on, say you would want to do a troponin as well, the troponin is also elevated. Now, make up your mind on the diagnosis and attempt our quiz given below. I'll see you after you've done it.